Hello. Thank you for taking the time to learn more about our PGY1 Pharmacy Residency program at Mayo Clinic Health System in Eau Claire, Wisconsin. My name is Melanie Momartz, and I am the Residency Program Director for our PGY1 Pharmacy Residency program at Mayo Clinic Health System. I have been an acute care clinical pharmacist for the past 8 years here in Eau Claire, and I also completed this PGY1 pharmacy residency program in 2014. My current clinical primary focus is on our neurology and trauma floor. Travis Miller is the Assistant Residency Program Director. He has been an acute care clinical pharmacist here for the past 15 years, where his primary focus is cardiology. Today, I am excited to share with you more specific information regarding our acute care residency. The pharmacy department in Northwest Wisconsin provides a wide variety of services that support inpatient facilities and ambulatory clinics, as well as prescription dispensing services for patients. Our inpatient pharmacy practice spans across 5 hospital locations. The primary hospital location is in Eau Claire, where our typical hospital census runs around 170 patients daily. We have on-site pharmacists at all 4 critical access hospital locations during the weekday, and night and weekend coverage is supported by the pharmacy team in Eau Claire. We have a very robust ambulatory care practice with pharmacists embedded in several service lines throughout our clinics. Mayo in Northwest Wisconsin has been at the forefront of healthcare innovation by offering advanced care at home or hospital-level care to patients in their own home since August of 2020. This service is offered through collaboration between multiple healthcare disciplines and technology-enabled monitoring equipment. Our pharmacy staff conducts patient reviews, participates in virtual rounds, configures each patient's in-home automatic tablet dispenser, prepares IV medications, coordinates in-home medication delivery, and completes a medication consult with patients as they transition out of the service. Several outpatient pharmacies and 1 compliance packaging pharmacy are located within the region that are supported by pharmacists who provide medication management services, patient counseling, and respond to drug information queries from healthcare team members across the region. Our program has been accredited by ASHP since 2009. We have up to 4 residents annually, and the goal of our program is to highlight the pharmacist's role within an integrated health system. In the next 2 slides, I will discuss the variety of rotations that we offer to our residents to allow them to become more well-rounded. This program provides more of a focus on acute care. However, there are also several ambulatory rotations that we feel are integral to helping our residents become well-versed in all aspects of pharmacist roles within a health system. Previous residents who have graduated from our program have gone on to complete PGY2 programs, most recently in emergency medicine and informatics. Other resident graduates have gone on to work in inpatient and ambulatory care settings. One thing of note that I think speaks to our work community is that we currently have 13 former residents on staff across the Northwest Wisconsin region and 3 former residents who work in Rochester. Required rotations have been developed to give our residents a well-rounded learning experience across the full spectrum of health system practice. As you can see, most of these rotations are 3 to 4 weeks. So looking at the inpatient rotations, they include cardiology, critical care, medical, surgical, and neurology and trauma. Cardiology and critical care rotations may be extended as an elective learning experience for those who have a further interest in those areas. Our inpatient pharmacists provide a wide variety of services, including pharmacokinetic and anticoagulation dosing, parenteral nutrition support, transitions of care management, and antimicrobial stewardship. Our pharmacy department has an excellent working relationship with the hospitalist and specialty provider teams who work throughout the region. Our ambulatory or outpatient rotations include ambulatory pharmacy, medication management services, also known as medication therapy management, and oncology. Our region offers a robust ambulatory care pharmacy practice that is integral to primary care clinics as well as specialties, including oncology and anticoagulation. Pharmacists are embedded within family medicine, internal medicine, and oncology departments where they provide medication management services with the goal of optimizing medication regimens through team-based care. We also offer several elective rotation options to give our residents an opportunity to tailor their residency schedule to align with their practice interests and future career goals. Typically, elective rotations are a 2-week concentrated learning experience, but can be extended to 4 weeks depending on a resident's interest level. Most residents complete 4 to 6 electives depending on the elective lengths. As you can see, some of the electives that we offer are based out of Rochester, Minnesota, or at our Critical Access Hospital in Menominee, Wisconsin, which is about 20 minutes from Eau Claire. So if you were to match here, we can work with your schedule to accommodate these rotations based on preceptor and housing availability. Staffing is an important year-long learning experience for all of our residents. Our staffing schedule allows residents to work independently while having experienced pharmacists available to assist when needed. Staffing orientation is completed from July to August, where a resident will be paired with another preceptor, with independent staffing starting in September. Residents work an 8-hour shift on Friday and 12-hour shifts on Saturday and Sunday, with the following Monday off after the weekend. Each of our residents will staff on 2 holidays and 1 week around a fall or winter holiday. We also have our residents staff at a free clinic once a month starting in September. The Open Door Clinic is held in Chippewa Falls, which is about 20 minutes from Eau Claire, and it's on Tuesday evenings and is a great way for us to give back to our community. Aside from staffing, our PGY1 program consists of 4 other longitudinal learning experiences. We have an extensive research curriculum for our residents that includes all Mayo residents across the Midwest. At the beginning of each year, the resident will select a research project from a vetted list of projects the pharmacy department provides. As a department, we strive to choose projects that are both meaningful and have a significant impact within our health system. Once you have selected your project, you will be paired with a pharmacist mentor and research team to help guide you through the research process. Residents will present their research as a poster at the annual Vizient meeting held in conjunction with the ASHP mid-year clinical meeting in December, and they will also give a presentation with their final results of their research at the annual Wisconsin Pharmacy Residency Conference that is held in the spring. Along with research, our residents will also engage in a quality improvement project during the year. These QI projects are enterprise-wide, thus allowing residents to interact and work with other residents and pharmacists across all sites of Mayo Clinic. All of our residents will also complete a teaching certificate. The teaching curriculum involves creating a teaching philosophy, delivering presentations to our family medicine residents on site, and also one formal pharmacy grand rounds presentation. Our residents also have the opportunity to participate in the Mayo Clinic School of Health Sciences Physician Assistant Pharmacology curriculum. Residents will spend 4 weeks dedicated to precepting a 4th-year pharmacy student on site here in Eau Claire. We are fortunate to have a very involved leadership team here in Northwest Wisconsin. Our leadership team will interact with our residents regularly throughout the year to discuss management and leadership-based topics, as well as becoming involved in the medication error reporting evaluation for our department. There is also an elective available in pharmacy administration and leadership if a resident would like to spend more dedicated time with our leadership team. The PGY1 residency program offers an excellent benefits package, including competitive salary, on-site childcare, and health insurance. All of our residents have 15 days of paid time off during the year, and we encourage our residents to utilize their PTO to maintain their mental health and wellness during this challenging year. Mayo Clinic also has an employee assistance program that is free and confidential, where residents can be connected to resources for wellness, mental health, and financial resources. I want to switch gears very briefly to talk a little bit about the city of Eau Claire and its surrounding community. Eau Claire means clear water in French and was founded near the confluence of the Eau Claire and Chippewa rivers. It has a population of over 68,000 people and is the 9th largest city in Wisconsin. Originally a lumber town, Eau Claire has become a cultural hub for the arts, music festivals, and fine dining, among other attractions. The Chippewa Valley hosts 4 major music festivals each summer. While the pandemic has put many of these activities on hold, Eau Claire offers year-round outdoor opportunities. Many lakes and rivers are surrounding Eau Claire for recreation, and we also have several biking, hiking, and skiing trails. The city maintains 3 cross-country ski trails inside the city limits, and Eau Claire County grooms and maintains 3 additional trails outside the city limits within the Eau Claire County Forest. There are also over 35 miles of continuous hiking and biking trails within the community. Opened in the fall of 2018, the Pablo Center at the Confluence is located in downtown Eau Claire and includes a 1,200-seat theater and a 400-seat flexible theater. Their mission is to focus on augmenting and developing regional education opportunities in the performing and visual arts for people of all ages and backgrounds. If you are interested in learning more about Eau Claire and the surrounding community, please go to thinkauclaire.com. I want to thank you for taking the time to learn more about all we have to offer you at Mayo Clinic Health System in Eau Claire. If you have any further questions, please do not hesitate to reach out to one of us. Our contact information is on this slide, but you can also find it on our website. I also welcome you to follow the Mayo Pharmacy Residency Twitter account, which encompasses all residency programs throughout the Mayo enterprise. Thank you.